about safe sleep for babies. It's not for adults. So anyway, I'm here to talk about our project, our research project, our quality improvement project. We did a project on reducing sudden unexpected infant death in Essex County. And, I'm happy to be able to share my project with you. A sudden unexpected infant death is when a completely normal child goes to sleep, goes to bed, and then doesn't ever wake up. So it's a parent's worst nightmare. It's also, most of you may know this condition as SIDS, sudden infant death syndrome, but it also includes suffocation in bed, strangulation, and then some other unknown causes. So SUID is associated with unsafe sleeping practices. This is when a baby is sleeping on their belly, or when they are sharing their bed with mommy and daddy. So that's an unsafe sleeping practice, and unfortunately we have too many of those. It's also associated with premature birth, exposure to nicotine, and then also formula feeding, or really the absence of breastfeeding. And also the last point that I want to make is, also discrimination and disparities in healthcare can really influence SUID. So safe sleep practices was something we implemented in our hospital successfully, and I'm here to talk about that. They can be done easily. You can teach the parents before they get discharged. So we partnered up with the SID Center of New Jersey, and we got access to their free SIDS Info app, and also they donated onesies to be given as gifts to the babies. And I'll talk about how we did this. So now I talked about, you might wonder why social determinants of health would affect SUID. It's because of all those things that you see on the screen. Safe housing, transportation. Can you walk in your neighborhood without stopping a bullet or getting mugged? Are you experiencing racism, lower job opportunities? And then, can you even speak the language of the country? So these are all things that can affect families, and they do affect SUID rates. So just to put it in perspective, New Jersey being a well-developed state, we have the lowest rates of sudden unexpected infant death in the country. New Jersey does. But if you look at the rate for Black non-Hispanic infants, the rate is almost 4 times that of regular kids. So if you look at, I work in the Children's Hospital of New Jersey, which is at the Newark Beth Israel Medical Center, and we serve a lot of communities. But among the communities, there are 4 cities, which is East Orange, Irvington, Newark, and Orange, and they are the cities that have they experience adverse social determinants of health, and they have the highest contribution to the SUID rate in New Jersey. So they actually contribute, just those 4 cities alone contribute 96% of the SUID cases in Essex County, and 37% of the SUID cases for Black non-Hispanic infants in New Jersey. So what we did was, we wanted to provide education in a very unique manner, and we wanted to make sure that we would educate the nurses, so they in turn would educate the families before discharge. And so we went about it with a novel way. We wanted to make sure that at least 80% of the nurses were trained, and in turn, at least 80% of the parents were trained. So we started our project in December of 2020, and it's still going on to date. We created a set of processes so that for the nurses to follow to effect this change. And so what you see is a tag that we created for nursing. So in December of 2020, this sort of way was more novel. Very few hospitals were using QR codes to educate their families. So we partnered up with the SID Center of New Jersey, and they gave us the SIDS Info app. It's a free app, and basically we created a QR code for that app. And so if you scan the QR code, it takes you to a 5-minute video, and the 5-minute video educates you in English and Spanish about safe sleep practices, how parents can put their babies to sleep. So the first version, what you're seeing is the second version of the tag. The first version of the tag actually had just the QR code for, we just had a QR code for the iPhone app. But now this new one takes you to the Android, the Google Play Store, and also the iPhone App Store. And next to that, you'll see breastfeeding videos. Now, why do we have that? We have QR codes that take you to videos which teach parents about breastfeeding, because breastfeeding has an effect on SUID. Children who drink formula have higher rates of SUID. Children who drink breast milk are protected from, to a great extent from SUID. So we created QR codes for in English, Spanish, Haitian Creole, and Arabic. And just to share the statistic with you, about 37% of families in Newark do not speak English. They speak another language in their families. And then on the other side of the tag, we had some dietary-related important information. So, so I want you to see these onesies. They're very cute. They were donated by the SID Center of New Jersey. It says this side up. So basically, it educates the parents that the babies have to always sleep on their back and never on their tummies. So this was, the onesie is $6, and the book, we wanted to just get a revolution going. We want, we are counseling the parents to read to their children so that they can be successful later on in life. Start with reading right from the beginning. So we have this counseling, and we give this book, and the book is only $4. So, so to share our results, over 95% of the nurses received the education in 2021, 2022. Our efforts are ongoing. The app has been downloaded and seen by about over 75% of parents, and this is because the nurses supervise this, and that's the only reason that it is that high. And parents, those who didn't have a smartphone, whether they have the smartphone or not, they get a flyer about it. So all families have this information. And then the onesies were donated by the SID Center of New Jersey. So only 25% of our babies got the onesies, because we need an unending stream of onesies, and the financial stream dries up. And so more than 95% of parents completed the safe sleep education. So, so the SIDS Info app and the onesies, the combination of that was a very novel way of driving the education, and it really drove home the point. So the other thing we are doing is we want to screen all families for the social determinants of health. And I'm going to talk a little bit more about that in the next slide. So our methodology has been very popular, so much so that the system has now, I work with the RWJBarnabas health system. So our system is now going to implement our methodology in 4 other RWJBH hospitals: Trinitas Regional Medical Center, Claramas Medical Center, Jersey City Medical Center, and Cooperman Barnabas Medical Center. And the Partnership for Maternal and Child Health has promoted our method of training as the optimal method for all birthing hospitals in New Jersey. So I wanted to talk a little bit about social determinants of health. So now if you'll see the social and economic factors, education, family support, community safety, and then whether you live in a safe environment or not. If you live in a polluted environment, your chances of ill health are much higher, of disease are much higher. So if you'll see, healthcare and clinical factors only affect 20% of health outcomes. 80% of the health outcomes are affected by social, economic, and environmental factors. So that is something that is very profound. And really, I put this slide in. This is a call for action for all of you. How can we, this is a dynamic crowd. This is a crowd of change makers. So I want to see how can you interact, how can you help the health systems to interact with our families in a way that can drive the education home? How can we reduce the the adverse social determinants of health? So I wanted to share this quote with you. A civilization is measured by how it treats its weakest members. And it's a quote attributed to Mahatma Gandhi, sometimes to Pearl Buck and Hubert Humphrey, but it has left a very profound influence on me. I always, you want to make sure that you do your best job for every child. So I have a picture of a baby who's sleeping safely and hopefully dreaming of a safe future, beautiful future. But I also, wanted to, the second ask I have is that of course you can support the initiative by donating, but really what I would like is an unending supply of all the things, of the materials that we need to educate our families. I don't want to have to go crowdfunding with my hat out. So anyway, but thank you so much for letting me share our project with you. Thank you.